Della is the administrator, interfaces with a lot of different people. She deals with the patient, she deals with the staff, she deals with the community board, she deals with the businesses in the community, she deals with the public sector in terms of trying to attract funds to keep the health center going and to provide the services that she thinks we should be providing.
In the early years, we were basically focused on taking care of patients. And I would say about 25 years ago, we decided to shift that focus to not just take care of patients, but to take care of the health of the community and to work on issues that the people who lived in this neighborhood felt were most important. In the early days, they told us it was trash, lots, and cars, which we didn't think was a health issue. But we thought that's what they're interested in, that's what we'll work on. And we helped people to deal with trash issues. We converted abandoned lots into housing and tot lots, and we help people get rid of abandoned cars. Today, when we look at what's most important to people, it's violence and safety in this neighborhood. And that's an issue that we're working on and we're taking a leadership role on in this neighborhood. In addition, we also have heard from folks in the community that they want to have access to healthy foods, particularly fruits and vegetables. And so we're doing some work to improve healthy food access. And this is all part of our sort of commitment to taking care of the health of the community. Well, the farmers market is an outgrowth of a group of residents in this community who formed a group called Food in the Hood and decided that there were some things they wanted to do to try to improve access to fruits and vegetables, and establishing the farmers market was one of those. And the health center decided that we would take the responsibility for running the market to bring this to this neighborhood. We're in our, it's either the third or fourth year of the market. We've been fortunate to get some funding from the Boston Foundation to support a market manager. And we're hoping that we can build a sustainable market that will keep the farmers making a profit and provide fresh fruits and vegetables to residents over the years.
One of the things that we try to do is to talk to people about eating healthy food and eating nutritious food. What the farmers market does is bring healthy food into the neighborhood at a reasonable price. The other part of the farmers market is that the health center has also set up a program for the children, the community garden, where the children learn how to plant, how to take care of the crops, how to market their crops. Their crops are also for sale at the farmers market. Their produce has been excellent, especially the corn. But I always check out what's there from the children. And if I can buy a few of their products, I try to do that to support them.
And for me, it's really simple. I grew up in a home of activists, and my grandmother was a labor leader, and she led the 1909 strike. And it's fascinating to me right now because over the last couple of years, there's been a celebration of her work 100 years later. And it's amazing to me that someone could make that kind of a difference, and 100 years later, people are still recognizing it and acknowledging it. I grew up with her stories of organizing and left with a sense that helping people was really important. And I was lucky enough to find work where I've been able to do that every day, and I just feel really fortunate, and I feel like I'm sort of carrying on my family tradition. I think medical care is not so narrow, especially when you're talking about a community health center that has a commitment to taking care of people who are underserved, who are most vulnerable, who may have higher, not may, but do have higher conditions of chronic disease where rates of obesity are far higher than in other populations, who are living with the trauma of violence. So these are people for whom their community, their neighborhood, their lives have lots of injustice in it. And there's something that can be done about that. And I feel like I'm making a small difference in that.
Harry Truman always had that sign on his desk, "The buck stops here." Here at Bowdoin Street Health Center, the buck stops at Adela's desk, and she's handled that very